Missing a lot of it, aren't you? And this is a atypical follicular epithelium in here, so this is a follicular carcinoma. And you can see, what about the colloid? Does it look normal, or does it just look kind of broken up and not doing much of anything? It's abnormal. And you can see they don't have a nice lining of epithelial cells, because these are neoplastic cells. Okay? All right, so some of the established etiologies of canine hypothyroidism. Again, primary lymphocytic is at the top. And these are basically in order of occurrence from most to least as far as these orders are concerned. Idiopathic atrophy, follicular cell hyperplasia, neoplastic destruction, iatrogenic in there. Secondary, there could be a pituitary malformation. This is going to give you kind of the congenital hypothyroidism. Thyrotropic cell suppression. Again, that can be due to glucocorticoids, to other types of problems that can do this. And again, iatrogenic. You always have to put iatrogenic in there because what's iatrogenic mean?
Because
We don't have any idea, and unfortunately, lots of times that's often what we come up with. Well, we know it's got this, but why? But you say, well, if I can treat it, does it make a difference why? The problem is, if you don't know why, could it happen again? So that's one reason it's good idea to see if you can get the etiology, but if you can't, you don't want to just let the dog go or the animal go until you figure out what's going on, do you? You've got to treat systematically. Congenital, again, you can get thyroid gland dysgenesis, it can be aplasia, hyperplasia, ectasia. Dysharmonogenesis, and this is where there's a problem in iodine organification. And again, these epithelial cells are normal, but they lack some of the enzymes or stuff that's necessary for this. And so if you can't use the iodine, they can't make the hormone. And tertiary can be trauma, infectious agents, or neoplastic destruction, like a lymphosarcoma growing up in there, this type of thing going on. Okay. Well, as far as incidence of canine hypothyroidism, it is one of the most common endocrine disorders seen in dogs. Actually, in general, that adrenal problem would be the top of the list as far as the occurrence. Estimates range from about 1 in 150 to 1 in 500 of the cases seen by clinicians. I mean, that doesn't sound like much, but it is. You consider you see maybe 500 cases a month or something and everything, and you multiply that by all the clinicians in the United States or the world, you can see it's pretty high incidence. And one of the problems with hypothyroidism, lots of times the owners don't really notice anything until the animal dies, and they don't take it to the clinician when that happens. Okay? Now, it can occur in any breed, but demonstrates an apparent breed predilection, and that large-sized dogs seem to be affected more commonly than our small dogs. But, now, in any other endocrine disorder, the German Shepherd is one of the top breeds that gets it. But for some reason, the German Shepherd appears to have a lower than average risk for acquiring hypothyroidism. Maybe because the other endocrine diseases messed it up, so it didn't live long enough to do it, I don't know. But that doesn't mean a German Shepherd can't get it. But it's, every other one's, the adrenal disease and everything else, they're top of the list, basically. Okay. So here are some breed predilections. So you can see there's quite a bit of them in there. Now the ones that have the asterisks are the ones that seem to have a genetic predisposition for the lymphocytic thyroiditis. See the Beagle, the Borzoi. They've also seen Great Dane and Irish Setter, and the Doberman, and Old English Sheepdog. And again, if a question asks you what is the main breed that's affected by this, the ones that are going to be at the top are German Shepherd, Doberman Pinscher, as far as endocrine diseases are concerned. And they're also your, Irish Setters, pretty equivalent with it and everything else. Okay, but again, the Poodle also, but they don't get the congenital that often, but they get hypothyroidism from other problems. Okay. So the signalment. As far as canine hypothyroidism, most of the cases develop in middle-aged dogs, except of course for the cretinism. And usually about from 2 to 6 years of age. It doesn't appear to be a sex predilection, so it seems to be equally across both sexes. Your clinical signs, because your thyroid hormones have so many actions throughout the body, your signs can be very variable. It can depend upon which organs may be affected the most, earliest, and all this type of thing, how quickly you diagnose it, this type of thing. But your dogs are usually sluggish, they're overweight, and they will present with combinations of metabolic, dermatologic, reproductive, neuromuscular, ocular, cardiovascular, gastrointestinal, what's left? And hematological signs. In other words, there's so many different signs because it affects all systems. as far as the body is concerned. And just looking at the animal, you can't just look at the animal. Look at alopecia, it's got hypothyroidism. It could be other endocrine disorders. Okay, so you have to consider all those. Okay, here's a normal beagle. And what about that beagle on the right there?
A little chunky.
Kind of chunky, a little, oh, just want to go hug him, love him, right? He's so cute, right? But that's some of the things you'll see with hypothyroidism. His coat's not so bad yet, but notice the big body, because they're the same age. So you can see the big body weight and all this type of thing. As far as clinical manifestations, basically anything you can think of. But as far as metabolic, lethargy, mental dullness, inactivity, weight gain, cold intolerance. That sounds like a lot of us, doesn't it? Ocular, corneal lipid deposits, corneal ulceration, uveitis. And dermatological, you can get the symmetrical or asymmetrical alopecia, and you get the rat tail. What do you think the rat tail is? Does the rat tail have any hair on it? Are most dogs supposed to have hair on their tail? And they don't have the hair. Dry, brittle hair coat, you touch it, it comes off in your hands. And if you lose the hair, what are you going to get as far as skin coloration? Hyperpigmentation, acanthosis nigrans because of UV radiation. Seborrhea sicca, oleosa or dermatitis, in other words, you're breaking down that good barrier there. So you get all kinds of skin infections, this type of thing going on. Pyoderma, otitis externa, myxedema, all these are clinical signs as far as dermatological. For example, what about this little old dachshund right here? Doesn't look very happy, does he? He's not supposed to be a black and tan dachshund. He's a brown dachshund. So you can see the severe hyperpigmentation. Notice the abdomen, falling down there. And notice the hair coat's bad. It's a very poor hair coat in there, everything. And so here's another one right here. So you can see the hair loss on the sides there and everything. And also notice under where his neck up there, that's where a collar was. So you're going to lose hair wherever you have this friction rubs and everything. You can see the discoloration. Again, he's not supposed to have black on him. Okay? And this is not a clip job. Okay, this animal has lost a lot of hair. And just like a lot of your endocrine alopecias, they will maintain it on their head, ears, and feet for a long period of time. But in time, they will also lose that hair. But you can see, now how thick you think that dog's skin is? Very thin. Very thin skin. And that's one reason you get the seborrhea and all that kind of stuff, and you lose your protective barrier and everything. And you got to be a little careful. In any animal that has endocrine alopecia, let's say the dog's on your exam table and it starts to jump off and you grab it, you've got to be very careful. But there are cases where the skin's going to come off in your hands. And the owner, what do you think the owner's going to do when they see that? Probably faint. All right? And you think you're going to see them as a returning customer? You've got to be very careful when you're handling these animals. Okay, this is a 5-year-old miniature poodle on A and a 6-year-old miniature poodle B. Both of them have alopecia, hypothyroidism, endocrine alopecia. And again, you can see they're not quite as bad on the one on the, let's see, Ural's right, it's not quite as bad as the one on the left as far as alopecia, but they're getting there. Okay, but you can see the dark discoloration in there, and they just don't look happy, do they? And that's one of the things you'll see, depression. Here's another one. See the rat tail? Supposed to be a nice furry tail. Doesn't have hardly any hair on his tail there. And you can see the alopecia and everything, a little bit left on the feet. And notice how fat it looks, but it's not really fat. It's redistribution of some fat, but it's mainly large liver and large urinary bladder and stuff in there. Okay, I know this is a little dark to see, but if you look at this, this is an 8-year-old male Chesapeake Bay Retriever, had hypothyroidism. And you can see the poor hair coat over there. You see it looks like swelling and things over here. That's myxedema in there. And drooping of the eyelids, and you can see the rat tail.
I don't know if I missed it, but did you mention why the hair loss happens in the trunk and the tail? Like what?
The endocrine pattern of that starts on the sides of the trunk and on the inner thighs and stuff, and on the tail. Now, as far as the inner thighs and stuff, it's because of friction, because you lose your guard hairs first. And that puppy hair coat that's left underneath, and we call it puppy even though it's an adult animal, the small hair coat will rub off. And also on the sides, it seems like when they lay on it, they rub and this type of thing, you lose it there. As far as the tail, I don't know of any significant reason for the tail, but it just occurs. Okay? Now, it's the drooping eyelids and stuff up there. Here's another one that shows you a closer up of the mixed edema. You know, they're supposed to have a nice sharp jawline. This is definitely not a nice sharp jawline, is it? Here's a human with mixed edema. All up under here. It's not a second chin or anything, that's mixed edema up under there. Okay. Here's your rat tail. Again, not a total rat tail because it does have some hair left on it, but it doesn't have that nice bushy tail it's supposed to have in there. Okay, this is truncal hyperpigmentation. It's a 4-year-old female spayed boxer that had hypothyroidism. And you can see the severe pigmentation in the inguinal area of another dog on the other side here. It's not supposed to be black like that. That's just hyperpigmentation, UV radiation. And you can see the spots on the dog. This is not a spotted boxer. Oh, is there such a thing as a spotted boxer? I know that the bulldogs have them, but I don't think boxers do. But I don't know. But anyway, but not supposed to look like that. Okay, here's acanthosis nigrans in this little old dachshund. You can see up under in the axillary region there, black and everything. And basically just total hyperpigmentation in those areas. Again, that's acanthosis nigrans is the name for that. Here's another one. You can see all the black and discoloration and stuff. They did surgery on this animal for something. I'm not sure what the surgery was for, but anyway. And again, you can see, and lots of times that will be on the back, the neck, also in the axillary regions and stuff, when they lay down like that and everything, they'll get sun exposure and stuff like that. Okay, now some other signs. Those are all the dermatological findings, but, you know, thyroid affects everything. Reproductive, a persistent anestrus, testicular atrophy, of course, one's the female, one's the male. I don't have to tell you which one, right? Okay, we have loss of libido, weak silent estrus, prolonged estral bleeding, inappropriate galactorrhea and gynecomastia. In other words, it looks like they're pregnant but nursing because they have, you know, gall and scourged mammary glands. As far as cardiovascular is concerned, you can get bradycardia. What's bradycardia? Slow heart rate. What will hyperthyroidism do to you?
Fast heart.
Tachycardia. Okay. Cardiac arrhythmias will develop. You can get seizures, ataxia, circling, vestibular signs, facial nerve paralysis, weakness, and knuckling. Again, a lot of these have a lot to do with what's causing the lesion up here. If it may be encroaching upon other areas of the brain and stuff, we get a lot more of these types of clinical signs. And same thing with gastrointestinal, you can get either diarrhea or constipation. So you get either one. So you can't use that as a sign to tell you, oh, I got hypothyroidism. You see either one. Now, as far as cretinism, that's the basically manifestation of hypothyroidism in your young dogs, juvenile dogs, and they appear disproportionate. Remember when we talked about growth hormone, we talked about hyposomatotropism, how they kept their proportions, they're just smaller all over? Cretinism differs from that in that they're smaller, but they're not proportional. You're going to be, you know, kind of blocky looking and this type of thing when you see them. So they have large, broad heads, thick protruding tongues, wide, square trunk, short limbs. They are mentally dull, and they lack the playfulness seen in normal puppies. And you'll get the persistence of your puppy hair coat, which is just a thin hair coat. And again, is that going to stand up to any rubbering or will that fall out? It's going to fall out, so you get alopecia. They don't have much of an appetite. Your teeth will not erupt normally. And you can also have enlarged thyroid areas from goiter that are in there. And again, you have to differentiate from pituitary dwarfism and panhypopituitarism. Again, pituitary dwarfism by itself, it's going to be, you know, they're going to have the same relationship as far as it's going to be small all over. Okay, not going to be disproportionate. Whereas with panhypopituitarism, that could wipe out everything. So you should see a more broad range of clinical signs if that's what's causing the problem. Okay, the A and B are 8-month-old giant schnauzer litter mates. Which one do you think's affected? The one on the right up there. And if you basically you can notice see how blocky and thick his head is up there compared to the other his litter mate there, and how he's short in stature and everything like that. Now, if this were going to be pituitary dwarfism, he'd look like his litter mate, except he'd just be small. But he'd have those same proportions as far as head size to body size and stuff. Okay. If you see basically on the C and D down there, it's a 3-year-old male Doberman. That looks like a 3-year-old. Oh, he's so cute. Let's go get some puppies from him, right? Yeah, the same problems. They have congenital hypothyroidism, and basically a small stature, juvenile appearance, retention of your soft, fluffy puppy hair coat. And then as he gets older, he's going to get more and more disproportionate. And usually the lifespan's not that long. This is the same dog as in seeing via the previous slide, shown next to his litter mate there. Not hard to say there's something wrong with him, is there? Oh, I know his litter mate has gigantism, right? No, that's not the case, okay? So as far as laboratory findings are concerned, you may see no clinical pathological abnormalities other than your low T4 and T3 hormone levels. Okay? Now, increased serum cholesterol and triglyceride levels may also be seen because his metabolism is going to be normal. And increased cholesterol occurs in almost all metabolic disorders. And also his energy is messed up. So he's trying to make energy, so he's going to break down fat to try to make energy. Plus, cell membranes, thyroid hormone stabilizes cell membranes. When you damage cell membranes, you're going to leak cholesterol and lipids out. So you're going to see it with that. So you should always consider hypothyroidism in a dog that has a serum cholesterol concentration in excess of 600 milligrams per deciliter. Usually it's less than 150. Okay? You may have some mild increases in serum ALT, ALT phos, and CK. CK is the most consistent one. So that's creatine kinase. That's in striatum muscle. Again, are the muscles going to have to be moving and stuff? So if you've compromised the cell membrane, will you leak out some cytoplasmic enzymes? And that's what CK is located in your striatum muscle cells in the cytoplasm. And so you get leakage of that. So one of those consistent things you're going to see are hypercholesterolemia and increased CK. Now, if you're starting to get some compromise as far as the liver because of your cholesterol and all this type of thing, the liver's going to try to take it up. So you're going to cause leakage of the liver's enzymes, and that's ALT. And ALT phos is also a membrane transport enzyme. Okay? You get a mild, non-regenerative, normocytic, normochromic anemia. Why do you get that? What's one of the main stimulus for red blood cell production? The need for what? Need for oxygen. When do you need oxygen more? In a normal metabolic state or a hypometabolic state? If you're hypometabolic, you're not using oxygen, right?
Normal, hyper.
So hyper is when you need it, or normal is when you need it, right? So if you don't have an increased demand for oxygen, what's the kidney going to stop secreting? Erythropoietin. What's the bone marrow going to stop making a bunch of red blood cells? And so that's why you get a normocytic. In other words, the bone marrow says, well, I can go on vacation. You don't need me. And so the cells that are in the blood are the ones that they put out before. Or we'll put out a small amount, because the animal don't want it's not going to commit, carry by just stopping putting red cells out, period. It's just going to be just a low level of red blood cells coming out. And those that are in the blood, do they live forever? No, they're going to die after a certain amount of time, depending upon species, which and how long. And so the bone marrow's not putting them out. So what's the PCV going to do? Well, it decreases. And what do we mean by normocytic, normochromic? Normal size, normal hemoglobin. Because if they are responding, if that bone marrow is responding to an anemia, what would the morphology be? Younger cells, which are macrocytic. They won't have their full hemoglobin, so they're going to be hypochromic. That's a regenerative anemia. Okay, if it's nutritional anemia, what are they going to look like? If you don't have the stuff to make the cell, they're going to be smaller. If you don't have the stuff to make hemoglobin, are they going to have less hemoglobin? So microcytic hypochromic is the nutritional type. Okay, y'all had that last year in histology when I taught you all that stuff? Y'all have it increased next semester rather. Okay? So, and for this, as I said, PUPD is not usually seen with this one. It's seen with almost all your other endocrine disorders, but not with this one. Again, if you have decreased metabolism, is the animal going to be needing water and everything to keep metabolism going and everything like that? No. So you don't get PUPD. So diagnosis. How does it think the best way to diagnose canine hypothyroidism would be? The gold standard in the past was the TSH response test. In other words, I administer TSH, what should the normal thyroid produce? It should produce thyroid hormone, right? And you can measure either T3, T4, or free T4, and it should go up. If I gave TSH to an animal and I didn't see a change, what could that tell me about my thyroid? It's non-functional. There are some things which affect it, but that used to be the gold standard. Why do I say used to be?
Something came on.
Our major source of TSH was British beef.
Mm.
What happened to British beef?
Foot disease?
Prion disease and all that kind of stuff, mad cow and all that stuff. So what happened to our ability to import products from British beef? Went down. Now you can get synthetic TSH that's human in origin, but again, anything that has human in the name, what does that do to the cost? It's very expensive, so we can still do that. But we've developed different ones. There's a new endogenous. What's endogenous mean?
Made within.
Made within. So there's an endogenous TSH assay that we can use, and we can use that in combination with free T4. Free T4 is the one that's less affected by euthyroid illnesses and things like that. So we can do a combination of TSH, endogenous TSH, and free T4. And it's very highly reliable. It's almost, when you do those two together, it's almost 100% reliability, which is rare for assays as far as that's concerned. And then basically, you can do early autoimmune thyroiditis is best diagnosed by measuring your thyroglobulin antibody, TGAA. Again, there's a SNAP test that's available for that you can keep in your lab. Now, one of the reasons it's important to do that, to know that, is since that antibody will cross-react with my thyroid hormone assays. So I'd run a total T4 and total T3 in this dog, and it's sky high. Oh my, I don't have hypothyroidism, do it. What it's measuring actually is the antibody. So that's why you want to screen with this test first and say, oh yeah, I've got these thyroid antibodies in there, so I know what I've got going on here. Okay. Now let me ask you this treatment now. I measure this dog I think has hypothyroidism. And this dog has a low endogenous TSH and low free T4. Does that confirm it has hypothyroidism?